Warm greetings from Nigeria. My name is James Beetseh, Assistant Watch Officer, UNHCR. Permit me to share with you our experience on an integrated management approach to cholera outbreak, prevention, mitigation, and containment in refugee settings. Generally, refugee settings are crowded and with unsanitary conditions that make them highly vulnerable to disease outbreak. According to the National Center for Disease and Control in Nigeria, in 2021, Nigeria had 111,000 reported cases and 3,600 deaths due to cholera outbreak. In 2022, Nigeria also led with 23,000 reported cases and 595 deaths due to cholera outbreak, making it the highest in West and Central Africa. As of March 2023, Nigeria is hosting over 87,000 Cameroonian refugees. 60% of these refugees reside in Cross River State, Nigeria. Within Nigeria, Cross River State is reported to have one of the highest incidence of cholera outbreak, and this has been very disturbing. UNHCR decided to facilitate a coordination forum of WASH, health, and government with the onerous task of establishing a preparedness and response plan. The forum was able to establish a preparedness and response plan with key components of information sharing and reporting lines, early warning triggers and signs, stakeholder identification and relevant government, NGOs, CBOs, the private sector. Roles and responsibilities were assigned accordingly. Facility inventory and identification, pre-position of medical and non-medical CRIs, capacity building of relevant stakeholders, upgrading of medical facilities, equipment, and personnel, and laboratory RDT kits pre-positioning, and establishment of environmental health clubs in schools. At about mid-2022, an index case of cholera disease was recorded. A 1 year and 4 months baby presented with acute diarrhea and dehydration at Ikogen PHC. The health sector quickly swung into action to manage the case, and they conducted tests, RDTs, counseling, treated and discharged, and follow up with the families at the settlement. The health sector went ahead to engage other sectors in a joint sensitization campaign outreach to all the 4 refugee settlements and the host communities. They also conducted a surveillance where they conducted 65 additional RDTs and confirmatory tests across the 4 settlements, and the result was identification of 2 additional positive cases. The information about this diagnosis were managed by the state epidemiology unit, who were also part of this team. At about the same time, the WASH sector also moved into the settlements, ensured that all dysfunctional water facilities were rehabilitated. There was point chlorination of all water sources, disinfection of the surroundings, water bodies, waste pits, latrines, bedrooms, especially around the flash point areas. There was also household water treatment and safe storage, capacity building of households, door-to-door hygiene promotion, and latrines for people living with disabilities were also rehabilitated and put in place to avoid open defecation. Distribution of P&G water purifiers around the communities, and also cleaning of dirty tanks, repair of pipe-borne leakages, weekly community-level environmental sanitation, daily household latrine inspection, and institutionalization of reward system were some of the ongoing activities. Government and the protection sector, on the other hand, supported capacity building and assessment of community management structures across the 4 settlements, distribution of CRIs, community sensitization, training of community leaders in settlements, and training of caregivers. One of the key challenges faced was getting government to play its role of providing needed leadership in funding, logistics, upgrading of medical facilities, and leadership in cases involving refugees in their states. In conclusion, medical intervention alone is not enough. Cholera is preventable if all stakeholders, including the target persons, play their role as planned. Mitigation and containment requires continuous, combined, and complementary efforts by all relevant stakeholders, and this is what we refer to as integrated. All the interventions must be complementary to each other and on a continuous basis. Thank you very much, and God bless you.